healthcare scenario in the last few years has changed a lot. Our previous generation did not have a strong habit of taking care of their own health. And then this is reflected in a lot of the diseases that we see today, like hypertension and obesity and diabetes. And what I asked you, what has changed in the last few years?
The reality is, ever since COVID-19, Juliana, I think people are taking more and more care of themselves than they ever have before. Not many of us in these generations have lived through such a pandemic where we have seen up close and personal the impact of health and the impact of better health. And quite frankly, I think it maybe has brought a lot of people to realize that their everyday health is more important than ever before. If you think about simple things during the pandemic, like washing your hands, this became something that people paid more attention to, even though it's something we've always knew. People were paying more attention to germ kill. People were paying more attention to germ management. People were wearing masks. I think all of these things over the course of that kind of 2-year period has really made people realize that paying attention to your everyday health is more important than it's ever been before. I mean, even in very advanced and developed markets like the US, 50% of consumers are now saying, I'm paying more attention to my health than I ever was before, which is up since 2020, right, where it was about 40%. I think it also, COVID had an impact not only on people thinking about their physical health, but also thinking about their mental health. During that time, it was very difficult for mental health as well. And I think it brought to the surface that people need to take care of both their mental and their physical health. And I think finally, as always with healthcare, I think governments are paying more attention than they have before. I think you're seeing more government campaigns where they are paying attention to health and overall health. You're seeing policies changing that are allowing greater access to things like self-care. You are seeing greater campaigns from governments about the benefits of taking care of oneself, managing your health habits in order to be safer throughout the course of your life. And this goes all the way from our older populations all the way down to the babies and the way that we're managing that. And I think it's also for the benefit of things like health literacy and health understanding. So I think the last 3 years have really been impacted by COVID. And I think you were asking me, do I think it's here to stay? I think it is. I think it is because it's still fresh, right? Unfortunately, Juliana, a lot of people lost loved ones during that period in time. People saw devastation and loss of life like they've never seen before. And I think what they're also realizing is that through some of these daily self-care practices, they're seeing some benefit from themselves as well. They're seeing that, I can manage my health better than I have in the past. I'm actually feeling better than I have in the past. I can be more proactive about my self-care. So I do believe it will be around for some time to change.
And what do you think are some self-care actions that should be included in everyday life?
Yeah, I mean, listen, I think there's a couple of things. You asked me, why do I think it's going to stay around? I think there's a couple of points. One is the demographics, right? If you look at the global population who is 65 plus, that population keeps growing and growing, and so their healthcare needs are going to grow. I think a trend that's very, very important is the role of technology in healthcare. I'm here at the Congress, and they're talking about healthcare literacy. And one thing that they're talking about is, while everybody may not have access to healthcare, it seems everybody has access to a mobile phone. And it seems everybody has access to a smartphone. And so our ability to share health literacy and health educational data and using technology in order to help people be more compliant. For example, reminding older people when to take their medication, how often to take their medication, and what medication to take when. These are the kinds of things. So technology, I think, is a big trend. The other is sustainability around the world, even in regions like Latin America, where maybe sustainability wasn't on the top of the priorities. Now you're seeing things like environment infecting allergies. Right? We've seen that around the world where now the environment and what's happening in the environment is creating an increase in allergies, and we have to pay attention to that. Or you look at, right now, many of our millennial moms are right in the middle of taking care of their children, and they had those children during the pandemic. So their viewpoint on healthcare and self-care and how important it is, I think that's really where it is. The fact that those trends are going to drive where people are feeling about self-care. When I think about daily rituals, Juliana, I can't help but think about Kenvue, right? We are the world's largest pure play consumer health company in the world. We have the chance to touch 15.2 billion lives every single day through these precious daily rituals where we are able to help people better manage their health and better manage their healthcare. Before I jump into Kenvue, I think just a few things. I think, the daily rituals of sanitization, right? And managing your germs, I think is something that is now more prevalent than ever been before. Everywhere you go, right, you will see opportunity for hand sanitation. You see the people managing when they're sick, making the choice to wear a mask. I think this is a new trend that we're seeing, right? Where people are actually taking that daily step to say, I'm not feeling as well as I usually do. I'm going to wear a mask, because in their mind, the idea of now I can protect others. When I think about Kenview and I think about our daily rituals, immediately what comes to my mind is Listerine. I'm sure here in Brazil, you know Listerine very, very well, right? And Listerine is a notable example where we're trying to raise the standard of care. The reality is there's a connection between your oral health and your overall physical health. And when you think about something like Listerine, where our research shows that it's 5 times more effective than flossing in terms of plaque reduction, by the way, plaque that also can affect your overall health, this is a daily ritual that we want people to be engaged in. Or even when I think about some of our daily baby products, and using lotion and massage for early birth babies is critically important for their development. So these are the daily routines that I think we need to bring into our lives and that we need to pay attention to, not only to protect ourselves, but also to protect others.
Do you think this act of self-care can impact in the health long-term?
Impact total health long-term, you mean?
Yeah.
Yes, absolutely. Juliana, I'll ask my team to share with you something called the socioeconomic impact of self-care. So this was a study that was done by the Global Self-Care Federation. I happen to be a chair of the federation as well. And we did this study with economists to understand what is the impact of self-care in the long term. And it is incredible to see what the impact is. Self-care for minor needs is actually saving $119 billion globally in the healthcare system. That's a massive number. If you think about the impact that it has across the globe, it has an impact not only on dollars saved in healthcare systems that we don't need to spend on healthcare, it creates more productive hours for people on a daily basis every single day. So it increases our productivity globally by about 11 billion hours. Now, that's just in 1 year. I don't know how many days that is, Juliana. I haven't done the math, but that's a lot of impact on our productivity overall. And it also has a massive impact on the productivity and the availability of our healthcare professionals. As you probably know, in this market, there's not enough healthcare professionals available. If they were not spending time on these kinds of incidences, we believe just here in Brazil, we could free up about 100 million hours a year. 100 million hours a year of healthcare providers being able to focus on more significant health needs. So when you ask me about the longer term impact, what immediately comes to my mind is the impact that it's having today. And we don't even have full access today. We do not have universal health coverage today. We do not have good enough health literacy today. So if we're able to advance that and advance the education and quite frankly, influence government policy, I have to tell you, I'm very excited. I think governments are starting to see the benefit of this, starting to see the benefit of the savings it can have on the healthcare system, and starting to see that if we do this, we can have more productive people and healthier people. At the end of the day, Juliana, right, it's all about better health outcomes.
How can the government help with this?
Yeah, I think this is a big, big idea. We were just debating this we had our executive committee meeting for the Global Self-Care Federation talking about this. The reality is we need to weave self-care into policy when we talk about universal healthcare. We need to make sure that self-care is the first line of healthcare that we are providing for minor needs, and that's not currently in the policy. We also need to make sure that in markets where we have insurance policies, that properly adjudicated self-care is part of those policies as well. And quite frankly, for the Global Self-Care Federation, we are on a mission to achieve a WHO resolution, hopefully by 2025. I think that's going to help a lot, Juliana, because when the WHO makes a resolution, then you have to have a strategy. When you have that strategy, it's then asking the member states to have a strategy towards self-care. I think if a member state has to have a strategy for self-care, then all of a sudden it starts to work its way into policy. But when it's not policy, it's very, very difficult to make sure that it is properly used, properly adjudicated, and more importantly, the first line of defense. So policy is a huge part of making self-care the first line of how we manage healthcare for all of our patients.
And do you think the governments are interested in changing that?
I think so. I think obviously every government, Juliana, country by country is in a different place. I know that we work with Anvisa and all the other local government teams in order to manage this and have conversations. What I can tell you is that while we haven't necessarily seen all the policy change that we want, I think the COVID pandemic has also created an opportunity for us to have more of a conversation on this topic, right? And I think we're starting to see some of the policy shifts that we want. As a matter of fact, I think we have about 4 member states from around the world that have already sent letters to the WHO saying that they want a WHO resolution on healthcare. I think we have several more coming in for Latin America. To me, that's the early indication that yes, they are willing to change policy for this. They do see the benefit of self-care in terms of managing overall health.
And can you talk a little about the importance of self-care to mental health?
Yeah, this is a very, very important topic. I appreciate you bringing it up because you know why? Not everybody wants to talk about mental health. It is still a bit taboo. And I think in the Latin culture, it might still be a little bit taboo to talk about your mental health, particularly for some of our men, very difficult to talk about mental health. But the reality is there is a great correlation between mental health and physical health. And we're realizing that there's a strong connection between the two. And it's really important that we are prioritizing both. So self-care is linked to improved mental health. If you're not feeling well physically, it is very difficult to feel strong mentally. And this includes things like self-esteem and self-worth and optimism. It's hard to have that if you're not feeling well from your own physical health perspective. And the reality is we don't take good enough care of ourselves physically, so therefore we're not able to have the strength we need mentally. So this is where we're working in this space, but I think there's an absolute correlation. Just think about yourself. It's probably very difficult in those days that you're feeling sick for you to feel your best mentally, right? So there's a connection. And so if we can help people with our physical health, we can also help with the mental health too.
Okay, cool. I think that's it. Thank you very much.